This is the Chapter 10 Skeletal System lecture, rather musculoskeletal system lecture. The function of the musculoskeletal system is to provide support and protection. Support are the bones that offer support are our cranium to support or protect our brain, our spine, which serves as protection for our spinal cord, and our ribs, which serve as protection for our heart and our lungs. It's also responsible for movement. Our bones make it possible for us to move and to ambulate. It's also responsible for the production of blood. The inside of our bones, our bone marrow, is responsible for manufacturing new blood cells. The musculoskeletal system is also a storehouse for minerals, and specifically we think about bones, we think about the storage of calcium needed for strong bones. There are three types of muscles. There is skeletal muscle, which is action controlled by will. We tell our body to move. Cardiac muscle, which is involuntary contractions. Luckily, we don't have to tell our heart to continue to beat. And smooth muscle, which is action not controlled by will. And this would be your gastrointestinal tract, which it moves on its own through peristalsis, and we don't actually tell it to do that. Actions of muscles. Body movements produced by the muscle action in your textbook on page 300, they talk about adduction. And if you remember, the prefix ad means towards. And so if you are adducting something, you're moving it closer to the midline. And so they show a figure of a lady who is bringing her arm and her leg closer to the midline of the body from an outstretched position. And then abduction is the opposite. It's moving away from the midline of the body, and so it's taking the hand and moving it outward and the leg moving it outward. Another motion is flexion and extension. If you flex a muscle, you'll see the lady in the picture, she is bending her arm and decreasing the angle of the joint. So the angle of the joint is right at the elbow. Then with extension, she's increasing the angle of the joint. So she is extending her arm out fully so that it has a 180-degree extension. Rotation then, at the top of page 301, is moving a bone around its longitudinal axis. So you could move the neck around, you could move the torso around. Pronation and supination. Pronation is turning the palms downward, and supination is turning the palms upward. Inversion and eversion, if you look at the example there, it shows the foot, and eversion is rolling the sole of the foot outward. Inversion, then, is moving the sole of the foot inward. Plantar flexion and dorsiflexion. Dorsiflexion is elevating the foot, not necessarily that you are putting the foot up in the air, but you are pointing your toes towards your nose. Plantar flexion, then, is the opposite. It's lowering the foot and pointing the toes away from the body. The vertebral column, if you remember from the, what system did we have that? Oh, it wasn't in a system. We had it back in chapter 4, body structure, and we went through the different sections of the spine. The cervical vertebra, if you remember, there are 7 cervical vertebrae in the neck region. There are 12 thoracic vertebrae in the chest region. There are 5 lumbar vertebrae in the lumbar region, or lower back, and the sacrum, there are 5 sacral vertebrae. And then, if you remember, the coccyx is the little guy peeking off the end here, and it is comprised of 4 fused bones. The intervertebral discs separate the vertebra with flat, round structures composed of fibrocartilaginous substance. So I like to think of it's this jelly-like substance right here. I like to think of that as our shock system for our vertebra, so that the vertebrae don't crunch together. So much like the shocks on a car, it absorbs if there is, any kind of jolt to the system. One problem that is seen when that fibrocartilaginous substance does not remain where it needs to be is a condition called herniated nucleus pulposus, abbreviated HNP. And this is when disc material protrudes into the neural canal and puts pressure on the adjacent nerve root, causing pain. So if we go back to this, if you see, this is the fibrocartilaginous substance here. And what can happen is this can actually kind of be forced out into the neural canal this way. And then there's all kinds of nerves that stem out from the spine, and so it's going to put pressure on one of those nerves. That causes the patient an immense amount of pain. It's also known as a slipped disc or a ruptured disc. That's what most laymen call it, a slipped or ruptured disc, but the medical term for it is herniated nucleus pulposus. Pathology that we see of the skeletal system, obviously one of the biggest problems we see of bones is people who break them. So if you look in your book on page 322, it talks about the different types of fractures that are common. Now there's literally multitudes of types of fractures, but your book goes over some of the more common fractures. There's spiral fractures, there's boxer's fractures, there's snuff box fractures, there's all kinds of weird name fractures, but these are some of the common ones. So a closed fracture is when the bone is broken, but there's no external wound. So closed, they show on page 322, is a break completely through the bone. An open fracture is when the broken bone is pushing out or protruding through the skin externally. And so you see that on number 2. And these are the types of fractures that you see on Sports Center when somebody, like a football player, is chop blocked from the side and their tibia or fibia snaps and it just busts out through the skin. A complicated fracture then is when a broken bone has injured some internal organ, and so typically we see rib fractures that puncture a lung or sometimes can lacerate the liver in the right upper quadrant. A complicated fracture then is, I just said complicated, sorry. A comminuted fracture is when the bone breaks and splinters into pieces, and this is really one of the most severe breaks. Because when the bone breaks and shatters like that, there's not really anything that the body can do to knit the bone back together. Our body has natural healing processes so that when there's an incomplete fracture or a partial fracture, it will knit new bone together and mend that break. But in a comminuted, it splinters so much that there's not really anything that can heal back together. So those are going to need surgical intervention, which we'll talk about in a little bit. An impacted fracture then is when one end of a broken bone is wedged into the interior of the other. And so they show a example of a femoral head, which kind of fractures and then wedges itself into the femur. An incomplete fracture then is number 6 on page 322, and that's a line of fracture that does not extend through the whole bone. If I had to pick a fracture, that's probably the one I would pick, only because it's going to heal more than likely on its own with just stabilization of it. A green stick fracture is when the bone is partially bent and partially broken, so it got its name from green sticks, like when you're out in your yard and you're picking up twigs and you have one that fell out of a tree prematurely and it still has some life in it. You go to snap it over your knee and it breaks in one part on the top part, but on the bottom it just bends. Then a hairline fracture is a minor fracture with the bone in perfect alignment, and it looks like a very thin line but does not extend through the bone. That isn't actually is not pictured in your textbook, but it's worth mentioning because hairline fractures can be quite painful and many times are missed on a normal x-ray. They have to be diagnosed with either a bone scan or an MRI. A pathological fracture then is a fracture that's caused by a disease process like osteomyelitis, osteoporosis, or any type, like let's say multiple myeloma, Paget's disease, any type of a bone disease that causes a fracture to happen because it's already basically kind of compromised the integrity or the strength of the bone. So how do we fix fractures? Well, typically, it depends on where it is on the body. A lot of times we'll use a cast to immobilize that bone so that it can grow back together. In the case of the comminuted fractures, surgery is used to realign the bones, and many times requires the implantation of metal rods, screws, pins, plates, and other hardware. So in the picture here, this is called open reduction and internal fixation. So this is somebody who fractured their ankle, and it was probably shattered, and you can see that there is a metal rod that's into the lower bone of the leg, and then the prosthetic ankle here. So ORIF is any implantation of plates, screws, pins, hardware that's used to kind of set the bone and make repair of it that needs more aid than what the body is able to heal. Osteomyelitis is a term that's used to indicate inflammation and infection of the bone and the bone marrow. It can be acute and chronic. If you remember the difference between the two, acute is sudden onset, short duration, and chronic means a condition which is longer lasting. With osteomyelitis, we see this frequently in diabetics, specifically in their lower extremities, their feet. When they get a sore on their foot, if you know or have been around diabetics, you know that sores on the feet of diabetics do not heal very well, and sometimes those sores can get quite large and can be quite penetrating to the point of getting down into the bone. And this would be the case for osteomyelitis. Another place that we see osteomyelitis is in patients who have really bad bed sores or decubitus ulcers from being on their coccyx too long. If they're bedbound, we'll see osteomyelitis set in those bones as well. Osteoporosis, then, you guys have all probably heard of. It's a decrease in the bone density. So I like to think of it as like a sponge. Your bone should be like a brick, and if it's like a sponge, you have porosity to that bone, which makes it more predisposed to fractures. And so as we age, we lose height. So we have a female who at age 40 starts out at 5'6", and then by age 70 is just barely clearing 5 foot. And so with osteoporosis, there's the compression of the spine. And you see from A to B here, this is a normal spongy bone, what it should look like. And then here's spongy bone characterized by a loss of the bony material and a thinning of the bones, if you will. So you can see how fractures are more prevalent if you've got a bone that's nice and strong here, but you've got one that's more like Swiss cheese here. It's got some weak spots, and it's not as strong as what it should be. Spinal disorders. Scoliosis is lateral curvature of the spine to the right or the left. So this here is an example of scoliosis. Kyphosis, then, is this little grandma down here in the bottom, and she has hunchback or humpback exaggeration of the thoracic curve. So here's her cervical spine, and then here's the thoracic curve here. Then the last one is lordosis, which is this gal right here. And you can see that, this is scoliosis. I apologize. Lordosis is this one up here, which is swayback or forward curvature of the lumbar spine. This is a really severe case of scoliosis. Another spinal disorder that's seen is spina bifida. It's a congenital defect, so babies are born with this, where they have a defective closure of the spinal canal, the spinal cord, or the meninges. This may or may not protrude. And so in this case, this baby was born with the spinal cord on the outside of the body, so obviously it did not survive. So this happens when the mother is pregnant and there's just failure of that neural tube to adequately form. And so that's why they do ultrasounds on mothers many times, is to look at the spine to see if there are any abnormalities, because they can actually do some surgeries in utero to correct spina bifida. Joint pathology that we see, rheumatoid arthritis. If you remember from Chapter 9, Blood, Lymph, and Immune System, this was an example of an autoimmune disease. So it's a systemic disease with inflammation of the joints causing crippling deformities. Now, with arthritis and rheumatoid arthritis, any type of arthritis, these patients have what are called exacerbations. Exacerbation is just a fancy name for a worsening of symptoms. And so it could be an exacerbation of COPD, an exacerbation of arthritis, of any other condition which kind of ebbs and flows, or they have good days and bad days. Rheumatoid arthritis can cause crippling deformities, specifically of the hands. If you look in your book on page 325, they show you what happens to the fingers of patients with rheumatoid arthritis. They get what's called swan neck deformities, where their fingers are pulled off to the side and they look hooked, almost like a swan's neck. Joint pathology that we see, spurs are common. Spurs occur where there's cartilage destruction and new bone formation occurs at the edge of the joint. So we see spurs, typically we think of heel spurs for patients, but spurs can also occur in the cervical spine. They can occur in the shoulders, in the rotator cuff. They can occur in the knees. So a lot of different places. And so basically new bone, or almost like a little tooth, starts to grow. And so you can imagine that these are extremely painful for patients. Heberden's nodes are, you can probably see these on your grandma or your grandpa. As people get older, sometimes they'll develop this bony enlargement at the distal interphalangeal joint of the finger. So it's the joint furthest away from your knuckle where your finger attaches. And so they'll get these an enlargement, or kind of like a bubbly appearance to the joints. Osteoarthritis is a very common term. It's also known as degenerative joint disease, and you will see this used in many, many, many different types of x-ray reports that you'll see. Really, it's rare to pick up a x-ray report unless it's of a kid and not see some degree of degenerative joint disease, because as we age, obviously, the joints begin to wear out. It is the most common type of connective tissue disease. Another form of joint pathology that your book talks about is gouty arthritis. Gouty arthritis, or gout, is an accumulation of uric acid crystals in the blood that deposit in the joints, causing painful swelling and inflammation. The odd thing about gout is that it most commonly affects the large toe, the great toe, but it can involve any joint. And so what happens is that joint will swell up and it will become excruciatingly painful for the patient, to the point where they have a lot of problems walking because of the swelling and the amount of pain. Muscle pathology that we see, muscular dystrophy, is a genetic disease with gradual atrophy or shrinking and weakening of the muscle tissues. This typically we see in children, affecting boys more often than girls, and these patients will usually die before the age of 20 because the heart is also a muscle and it is affected as well. Myasthenia gravis then is another form of muscle pathology that we see. neuromuscular disorder causing fluctuating weakness in certain skeletal muscle groups. Initial symptoms that patients will notice are weakness of the eye muscles, maybe some blurred vision, double vision, and some dysphagia. If you remember what that is, it's difficulty swallowing or eating. Diseases and conditions you need to know, starting on page 326. Actually, they start on 327. The first one is carpal tunnel syndrome, which we see quite a bit of, specifically in Northwest Ohio, because we have a lot of people who are blue-collar workers, factory workers, that work with their hands, and it's a painful condition that results from compression of the median nerve within the carpal tunnel. So what happens to these patients is they get numbness and tingling of their fingers as carpal tunnel initially sets in, and then they will begin to have a lot of pain in their hands. Now, we also see this with patients who do a lot of computer work where they're flexing their wrists a lot, hairdressers that are constantly using their wrists to cut. Anybody that is doing repetitive motions with their hands and wrists is more predisposed to develop carpal tunnel syndrome. Contracture is fibrosis of connective tissue of the skin, fascia, muscle, or joint capsule that prevents normal mobility of the related tissue or joint. Exacerbation, we talked about, is an increase in severity of a disease or any of its symptoms, also called a flare or flare-up. And then a ganglion cyst, a fluid-filled tumor that most commonly develops along the tendons or joint of the wrist and hands. Medical, surgical, diagnostic procedures, pages 300 through 334. The first one actually is on 331, arthrocentesis. If you break this term down, you should figure out the meaning is centesis, surgical puncture, and arthro, joint. So they puncture the joint and typically will remove some accumulated fluid. If somebody says, oh, I had fluid on my knee or fluid on my elbow, drain, this is the procedure they had done. Arthroscopy is visual examination of the interior of a joint and its structures using a thin, flexible fiber optic scope called an arthroscope. So they can go in there, they can look around, they can do some cleaning up of meniscal tears or fraying of the meniscus. They can do some other types of things while they're in there doing a arthroscopic surgery. Then over on page 333, total hip replacement is surgical procedure to replace the hip joint damaged by degenerative disease. So grandmas and grandpas a lot of times they say, oh, I'm going in to get a new hip, and so they are getting a prosthetic hip put in because of arthritis that's causing them problems. And then bone density test or a DEXA scan, which is on page 334. This is a test that's used to determine if a patient has osteoporosis. And so they measure in a number to determine if they have any wasting away of the bones, if their bones are beginning to get porotic or bony or spongy. To determine if a patient has osteopenia, the beginning of bone loss, or osteoporosis. Abbreviations to know for the quiz, page 336. CA means calcium, it means cancer, it can mean cardiac arrest, it can mean a few different things, but most of the time you're going to see CA meaning cancer. DJD, degenerative joint disease. FX for fracture. NSAIDs, non-steroidal anti-inflammatory drugs. So this would be, what's the name of it? Naproxen or some of those types of drugs. And then RA for rheumatoid arthritis. Remember that also means right atrium. ROM for range of motion, and that one's used a lot with physical therapists, occupational therapists that talk about we're going to do range of motion on the patient's such and such joint or to get them to get better strength. Spelling words to know for the quiz. Tendinitis, typically is misspelled right here with the a lot of people want to put an O here, scoliosis, femoral, chondritis, osteoporosis, arthroscopy, and dystrophy. You are responsible for memorizing the medical word elements and their meanings from pages 315 to 320. So again, you're going to make flashcards for those, and several of the quiz questions will come from these. Here ends the Chapter 10 Musculoskeletal System lecture.